Today we'll be doing trach care of a patient. The first thing I have is all my equipment set up. Here is my garbage. I have normal saline, hydrogen peroxide, Q-tips, sterile gauze pads, a drainage sponge, a new inner cannula, clean gloves, and then my new trach sterile kit. I will do my 7 steps, wash my hands, put gloves on. I will check my doctor's order. Then I will introduce myself to the patient, check that I have the right patient, and then maintain for the safety and privacy of the patient. So, getting started on the kit. So I will move my things aside so I can open up the kit. I will move this on to another table. The first thing I will do when I walk into the patient's room is make sure they are sitting at a 45-degree angle. And I will sit them up, listen to their lung sounds in all sections posteriorly. If they need assistance, I will help turn them to the side to listen to all those sections. Then I will check the suction on the wall. Turn that on. I will kink it and make sure that the suction can go from 100 to anywhere to 120. Then I will turn that off to prepare everything else that I will need. This right here is my trach, my patient. So after I have checked the lung sounds and made sure the suction works properly, I will open up my kit. Before I start opening up everything, I will have made sure to wash my hands. And this is a sterile procedure. In a normal setting, you want to make sure everything is above your waist when you are doing a sterile procedure. I'm opening up everything around my 1-inch border. Now, because I do not have the correct size table, I am imagining and pretending that my 1-inch border is not in contact with anything else and everything is being kept as sterile. This is my cup that I will be putting my saline into. This is my normal saline. I will check the expiration date. And then when you open up your kit, you should have a pair of sterile gloves and your suction. Right now I'm putting on my sterile gloves. Once I have my sterile gloves on, I have my sterile section. Now, during this procedure, I'm going to have one clean hand and one sterile hand. This is our patient right here with the trach. And right here is the sterile, the saline. This end I will connect to the suction on the wall. So once this is connected to the wall on suction, I will begin to check the suction, make sure that it works. Right now there's oxygen on the patient and they are sitting up. I will intermittently check the suction. Right now this is my clean hand and this is my sterile hand. I'll be checking that the suction works, and then I will be suctioning the patient. I will remove the oxygen from the patient, and I will introduce the catheter into the trach until there is resistance. I will then suction on the way out intermittently, go back into my saline and suction, and then I will go back into the patient, checking as well that their oxygen is fine, again to resistance, and then intermittently suction coming out. After that is all done, I will take my catheter and I will throw that out. I will remove this dirty glove, and then I will take off the gauze from the patient, the dressing. Next, I will wash my hands and I will put on my clean gloves. I will keep making sure that the patient can breathe and has enough oxygen. Next, we have the gauze, and I have my nasal cannula, my new, inner cannula, and my clean gloves. Q-tips, and the normal saline and hydrogen peroxide. This can now be thrown away. I will wash my hands and put on new gloves. So once I have my new gloves on, I will take out the old cannula from the phalange, making sure to keep everything sterile. And then this will be thrown away. I will then open my new cannula, inner cannula, and that will be placed. I want to take this out by the wings right here, and I will not touch this part here because it is sterile and will be going into the patient. Once that is in, you want to keep making sure that the patient has enough oxygen and that they can breathe. I will have then half hydrogen peroxide and half normal saline. I will open up my Q-tips. And I will dip it into my hydrogen peroxide and saline. Then I will clean under, dispose of that, get my next Q-tip and clean the top of the stoma, dispose of that. Next, I will get my sterile gauze. And I will dry under. Get another gauze pad. And then clean the top. While I'm doing this, I'm checking for any infection on the stoma, making sure that there is no redness or any other signs of infection. Once the stoma is all clean, I will place the oxygen back on the patient. And we can also place the new drain sponge under the cannula right above the stoma. I will put the oxygen back on and ask the patient if they need anything. I will clean up the area and I will reassess the lung sounds again. This time we should hear no more crackles. They should be clear. I will then leave the patient's room, clean up everything, and then document any signs of infection, the drainage, the color of it, the amount, and I will also make sure that the patient is comfortable and that they have their oxygen on. And make sure to document everything.